Worry about getting sick or vomiting? Do you avoid restaurants, travel, plane rides, pregnancy, or social events because of that fear? You might be dealing with something called emetophobia, the intense fear of vomiting. And while it can feel overwhelming, the good news is that effective treatment exists. Emetophobia is more than just feeling grossed out by vomit. Most people are grossed out by vomit. It's a powerful anxiety disorder that can take over a person's life. Some people with emetophobia are terrified of vomiting themselves, while others panic when someone around them feels sick. For many people, this fear leads to panic attacks, obsessive thoughts, physical symptoms of anxiety, and even isolation. If left untreated, emetophobia can lead to symptoms of agoraphobia, where folks are afraid to leave the house. People with emetophobia often begin avoiding situations where vomiting might happen. This can include things like eating at restaurants, traveling by plane or boat, social events, relationships, and pregnancy. Over time, avoidance can make life feel smaller and smaller. To try to feel safer, people with emetophobia often develop what we call safety behaviors. These might include excessive washing or cleaning, cooking food longer than necessary, constantly checking expiration dates at the store or in their own refrigerator, carrying anti-nausea medications, antacids, Zofran with them, always keeping ginger candies or crackers nearby. While these behaviors can feel helpful in the moment, they often keep the fear going on for much longer than normal. Emetophobia often begins in childhood. The average onset is around 9 years old, and it tends to occur more frequently in females. Many women report struggling with these fears for decades. The average amount of time that a woman reports having symptoms of emetophobia is 25 years. The good news is that emetophobia is treatable. One of the most effective treatments is something called exposure and response prevention, which scares the pants off of women with emetophobia because they have spent years avoiding things that were scary. And I think women are scared that when they come to treatment for emetophobia, that we're going to make ourselves throw up, which we do not. Like, that is not an ethical part of the treatment. ERP is a specialized form of cognitive behavioral therapy that helps people gradually face the situations they fear while learning new ways to respond to anxiety. But yeah, the goal isn't to actually throw up. It's about living with the uncertainty that I might have to deal with that. Um, yeah, helping people to tolerate that uncertainty and anxiety without relying on avoidance and safety behaviors. What does exposure therapy looks like? It happens slowly and gradually. A therapist works with you to create a step-by-step plan where you face fears in a way that feels manageable and supportive. The focus is building confidence and learning that you can handle uncomfortable feelings without letting the phobia control your life. Recovery from emetophobia isn't about getting over it, it's about being heard, understood, and supported while learning new skills to manage the fear. Even if you've struggled for years or decades, healing is possible. If you think this is something you're struggling with, if you live in North Carolina or Michigan, I can help you. If not, the International OCD Foundation, IOCDF, has a website and it has a search tool where you can find a therapist in your area. My website is jennlowe.care, JENNLOWE.care.